Hi, everybody. Uh, Here's Mike Hirsh, your guest host for another edition of Health Matters, the public cable access TV show of the Worcester District Medical Society in collaboration with WCCA TV. And I'm very excited to be hosting a guest, Dr. Joseph Sabato, who has some really interesting interests that are going to make Worcester a much healthier place. So as my Department of Public Health hat, I really feel this is a very important session that we're going to be doing together. So thank you for being here, Joe.
Thank you.
Thank you. So let me start out just by saying, millions of people became aware, if they weren't before, of the possibility of sudden cardiac collapse, near cardiac death, when the unfortunate Darrell Hamlin from the Buffalo Bills went down on national TV, and seeing him revived by a skilled team of sideline docs and medics and trainers has really been inspirational. And I know that the Bills did lose their playoff game, but seeing Darrell up in the stands giving his signature heart signal was really uplifting for many of us in the audience. And I don't really care that much about football, but it really drove home the notion that if you know to do the right thing when somebody goes down like that, it's a life-saving gesture and can make the whole community rock. So tell me a little bit about your interpretation of that and what it implies in terms of the programs you're trying to develop.
Well, I think it's a great example. And the thing that I have been sharing with people and reinforcing is the fact that cardiac arrest happens almost 1,000 times a day in this country. And so it's not a rare event that it happened. It was fortunate in the sense that it got the message out to people about this, that you can resuscitate people. It's long overdue that we paid attention to this, but it is something that happens about 1,000 times a day in this country.
And what do you think the major causes? I know, Darrell had a very unusual cause. Everyone's presuming that the timing of the blow to his chest hit his heart just at the wrong time. But what do you ascribe to be the major factors that could lead to sudden death like that?
Well, this is something that we've been doing here at UMass for the last few years, is we've identified the risk factors for cardiac arrest, because most of them occur before family and friends at home, 70%. Age greater than 50, a previous heart attack, coronary artery disease, congestive heart failure, diabetes, elevated cholesterol, high blood pressure, elevated lipids, family history of sudden cardiac arrest. So if you've had a relative who's died of a sudden cardiac arrest, you should be trained in what to do for your family. Certain EKG abnormalities in certain seizure disorder patients.
So that probably encompasses a lot of people around our county and around the Commonwealth in general. So having you can't have a sideline crew as developed as the NFL does, but if you had one person at that gathering in your family that knew what to do, that could make the difference between life and death.
In our program, which we call prescription CPR, only takes 15 minutes to teach it. And we've done verification studies to show then we teach people how to call 911, how to do hands-only CPR, and how to use a defibrillator. And as I said, we've proven that this teaching method is effective, and we've actually even saved some lives.
That's wonderful. I know that for many years we were struggling to try to keep AEDs at sporting events, having them adequately spread out amongst the schools. They're not inexpensive devices, and we were able to get grant money from the United Way and also from the Worcester Department of Public Health. Our Worcester District Medical Society paid for a few AEDs as well. UMass did, and I think the last partner that we had was also the Red Cross paid for a few. But
Right.
it's still not enough. And you just told me off camera that they have to be maintained too.
Well, that's one of the things, the key things, and it wasn't the city's fault that the defibrillators were not being maintained. It was the state of Massachusetts. When all the defibrillator laws were passed 8 or 9 years ago, the state did not do its job in reinforcing the law, meaning that if you had a public access defibrillator in a building, you were supposed to have a sign that said it was in the building so that people could find it. The other thing that hadn't been going on, in which we worked with Mayor Petty to fix, is that the defibrillators were not being maintained regularly. So myself and medical students who were interested in the defibrillator location and did that for their capstone project with me, we went and analyzed the defibrillators in Worcester and found that many of them had not been maintained. That was not the city's fault. That was the state's fault for not doing its job. And so we worked with Mayor Petty and the city, and we fixed all the defibrillators to get them, make sure that they were functional so that we could help save lives.
Oh, that's great. Well, Mayor Petty is really one of the most public-minded individuals as far as public health goes. And, you know, he gets a lot of credit for many, many public health efforts that we put in, especially our pandemic response. So, you know, one of the things that I wanted you to really reassure the audience about and make them understand a little bit more. I know you can't go through your whole course today, but I think people still have the image of coming upon a person that's been found down and having to do CPR involving compressions on the chest, but also rescue breaths. And there was a lot of concern about the sanitary nature of rescue breaths, and some of the people that, you know, have been found down have just vomited and they have secretions, and they don't always, people don't always have ways of separating their skin from your own skin. So what's changed, and what should we reassure the audience that this is a much easier process than ever before?
Well, the Heart Association has changed their recommendations because new data has come out that showed that the people who need to have rescue breathing are very limited. People that have experienced drowning or strangulation, those are folks that need or overdoses. Those are the folks that need that. But for the 95% of the rest of the people, you need only hands-only CPR, which has been made very, very simple. And what it is you shake the person to make sure they're unconscious. You see how they're breathing, and most people will not be breathing normal. But all you have to do is shake them and then do hands-only CPR. In the center of the chest, you push down 2 inches to the song Staying Alive.
The Bee Gees song from Saturday Night Fever.
And you keep the person's heart moving and moving the blood and keep the person alive until 911 EMS folks arrive at your scene and are able to take over and defibrillate the person. And the defibrillator, public access defibrillators, are pretty simple and straightforward. So you do CPR and then you ask for a defibrillator, and the defibrillator comes. One goes on the right shoulder and the other one goes on the left side of the chest, so that they will be analyzing through the heart. And then you turn the defibrillator on,
stabilizing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of patient. Deliver shock now. Shock delivered.
And you deliver the shock, and then you start CPR again at a rate of 100 to 120, pushing down 2 inches and releasing to the song Staying Alive. And this helps 30 to 40% of people who suffer cardiac arrest to be revived.
30% survival.
And the best survival in America is in Washington State, which is almost 60%. And that's because they have for almost 40 years been teaching bystander CPR, hands-only CPR, and how to use a defibrillator in all the schools. So everybody who graduates in Washington State from high school learns how to use a defibrillator and how to do CPR and save somebody's life. And we want to do the same thing in Massachusetts.
It sounds like a big task, but a very important task. Do we have worse stats than that in Massachusetts? You said 30% is the potential survival. Obviously, Washington State's doing better. Are we doing 30%? Or
Washington State has almost 60% survival. When I came back here 7 years ago, I asked for our numbers because statewide, we're not really keeping our cardiac arrest survival and weren't treating cardiac arrest as a reportable disease. Now we are trying to do that, and we found when they handed me our survival of 3 to 4%, when compared to the national average of 10 to 12%, I almost fell out of the chair. I was so surprised in Massachusetts would be this way. So we've been working hard to get the attention of the legislature and the previous governor to make this work. And we know that, and Governor Healy has endorsed this, and she's told us she's working with us on this. We are going to save 500 Massachusetts residents' lives this year by moving to best practice. And that's just a start. And I tell my friends and tease my friends that my goal is to make Massachusetts into the Seattle of the East, but with better weather.
Wow. Well, that's a wonderful aspiration, and I know that one of the wonderful things about our medical community is that with the colleges that we have, with the medical school that we have a lot of really great volunteers that will be like your disciples and help you spread the word and spread the skills.
Yeah, I can actually tell you that we've actually already had somebody that we saved. When I came back here 6 years ago, I taught all the volunteers at UMass how to do CPR and how to use a defibrillator. 2 days later, I get a phone call from the volunteer office asking me, Dr. Sabato, did you just teach CPR to people at UMass? I said, yes. I said, well, husband and wife were at a wine tasting in Shrewsbury, and the person giving the presentation collapsed. And they did CPR on him and defibrillated him and saved his life.
Yeah, that's proof is in the pudding there. That's wonderful. That's wonderful.
And that's wonderful, and we should all know what to do in this circumstance. And the other thing that helps us when we're in the midst of the crisis is by training the 911 operators that we call them about this situation so they can guide us through and back us up when we are doing CPR and using the defibrillator. And that's what we're trying to do. I can say that I have wonderful 911 telecommunicators working with me, and I'm proud to be their medical director.
That's great. Let me ask you, You mentioned earlier about overdose, and so many of our citizens, at least in central Massachusetts, are suffering from substance use disorder. We did see a reduction in fatal overdose over the course of the pandemic, but it's kicked up for 2022. And I think we have tried to really spread the word about Narcan, and very much like you've identified maybe a high-risk family that knows they have a person in it that has all these risk factors. You're going to teach them CPR. We teach the folks with substance use disorder, family member, to all use Narcan.
Right.
Are you able to tell or how do you tell your volunteers when you find somebody found down, like we sometimes will on the street, walking around the corner, come to a person who's found down, which do you assume is the likely culprit?
Well, the first thing is most often it's due to the heart, in most cases with things. So in that case, most often it is due to an arrhythmia that gets created called ventricular fibrillation, where the heart muscle stops contracting and so the pulse stops. So that's why hands-only CPR is so important in that circumstance with that. In people who may have overdosed and are not breathing, then they may need rescue. If they're not breathing, they may need rescue breathing to also assist them in order to restore their oxygen in their circulation with that. So it's a combination of things in that circumstance. But if you have a family member that you know overdoses or may overdose, then you should know what to do.
Right. That's been our attitude with Narcan, and we've worked a lot with AIDS Project Worcester to spread the education and also the kits of Narcan at no cost to the folks that are at high risk. So that's been a big part of our approach to the fatal overdose issue. Long time ago, when I was a medical student, one of the great privileges I had was doing a rotation with Dr. Bernie Lown. And, he was very instrumental in innovating on the AED, developing the AED, recognizing that lidocaine was one of the medications you could use for that arrhythmia you mentioned, ventricular fibrillation. And also, he spread the notion of CPR, couldn't get it to take off in Boston, but he got Fidel Castro to agree to pilot it in Cuba. And this was like when nobody was talking to Fidel Castro. And they developed a very involved education system for CPR. And much like you described for Seattle, they have a very high rate of resuscitation success because they teach it in the school. I think every kid over the age of 12 starts getting CPR education there. I don't think it would be hard for us to do that here.
What I've learned in the last few weeks is that one of the things that's made it difficult for the legislature to try and get CPR and learning a defibrillator be mandatory in the schools has been the superintendent's organization has resisted it. But I think they need to reevaluate it and look at this and realize this is an important life skill and that we need to help them get this through. And that's what we're working on right now with things, and that we have a number of laws that we're trying to get passed. They're on the Massachusetts Emergency Physician website, and we worked with them, and the new governor, Governor Healy, has told us when she found out what was going on, she said, I'm signing this legislation when I become governor. So she's working with us on this, and so is the Heart Association. Allison Perrin, who's the lobbyist for the Heart Association, has been doing a fantastic job lining up legislators to help us with this.
So one of the things I'm sure that our president, Giles Whalen, who until recently was also the chairman of the legislative committee for the Worcester District Medical Society, could offer would be, we have a legislative breakfast every year. Usually occurs sometime in March. Melissa, who's the producer of this show, is very involved in helping us set it up. And the legislators either come themselves, or sometimes they will send a designee, their chief of staff or somebody like that. And we present to them the critical issues in the docket for laws that are being considered. I think this would be a really good one. If you have the bills to talk about, we could put that on our radar and put it on the legislators' radar.
That'd be great.
They're generally very, very supportive if we, put our plea in, and then you could advocate for it yourself. I mean, we'd invite you to be the champion of that.
The interesting thing is that the legislation, one of the things in the legislation is to make sure that we're actually following best practice for defibrillators, where they are located, and we've also worked with some defibrillator companies to create posters that we put next to defibrillators, which we put in the city of Worcester, that because the data shows that 97% of the population does not know what a defibrillator is or what to do with it. So these posters address that. Tell people what a defibrillator is, and it is to stabilize somebody's heart rhythm so they can get their pulse back. That's the key thing for the defibrillator. In doing CPR and making sure you call 911. Those are the key things. Those are the things that make a difference in survival, and we are planning to institute those best practices in this state of Massachusetts, and we're going to save 500 lives this year.
That's wonderful. Well, we definitely have a lot of new ears for you to bend. We have a new superintendent of schools, Professor Menares. We have a new director of the Department of Public Health, Mr. Solo Dennis. We also have a student health advisory committee, which I sit on, which I could get you invited to talk
Sure.
about. This is with most of school nurses and some of the physicians that staff the school-based clinics. So I think we can really help you disseminate this very, very important information. I think the thing about Worcester, I think that we learned through the pandemic, is that we have a very, very community-minded group of government officials. Obviously, I think the health systems and the community itself. If you tell them that this is going to save 500 lives, that's going to resonate with people.
It is, and that's just a start, because I think we can even do better than that. The other thing, too, that we're taking very seriously and been publicizing and doing at UMass is the people with risk factors for cardiac arrest, their family and friends. When I came here 7 years ago, I met up with a guy by the name of Rob Goldberg from UMass. And Rob had been advocating for 40 years that we teach the people with risk factors what to do, because 70% of cardiac arrests occur at home before family or friends. But we haven't been teaching them what to do. And the key things are calling 911 and doing hands-only CPR, which keeps the person alive, so that when EMS gets there, they have a better chance of bringing that person back. And also learning how to use a defibrillator. So if you're in a place where there may be a defibrillator, and the other thing that we're also working on is working on a program to deliver defibrillators by drones to the site where the cardiac arrest is.
High tech, very exciting. We have also a group of students, and one of their capstone projects is to try to prevent drownings around the city, in our city pools and lakes and ponds. And so this is another area where I think I could hook you up with one of their leaders who's the head of the optional enrichment elective for public health. And,
Sure.
you know, Dr. Sabato is one of those unique individuals who's a specialist in emergency medicine and public health, and obviously is very dedicated to education. So, you know, our time is running out, as I knew it would too soon. So I wanted to just give you a moment to kind of encapsulate the main message that you would like to convey tonight. And again, I thank you for being our guest and for the amount of caring that goes into putting a program like this together.
Well, thank you so much. Well, one of the things is that we need, and what really helps drive this home is the football player who was resuscitated last week from the Buffalo Bills, and that he got CPR and got defibrillated, and he's alive today and he's home. That's not a very complex thing to learn. We should all know what to do when one of our family, friends, or even strangers collapses near us, doing CPR, keeping them alive, and then if there's a defibrillator nearby, getting that and putting that on the person, we're going to save many, many lives. And a lot of times these are family or friends or even strangers, but we're doing good stuff.
Well, thank you so much, Joe. I really admire your dedication, and this is something to tackle that we really, I think, could make a dent in with all the resources that we could bring to bear. So I want to thank everyone for listening tonight. I hope you gained something out of this. We'll have this episode up on our website at www.wdms.org. And we will also be giving you follow-up on how you can be involved if you want to learn this skill. Do you have any website at all that they can contact? Or?
I'm in the process of putting up a website called rxcpr.com, prescriptioncpr.com, to reinforce the people that have risk factors so that they know what to do.
That's great. Well, it's been another edition of Health Matters. Thank you very much. This is Mike Hirsh signing off. Thank you, Dr. Sabato, and keep listening. We'll have some more fascinating topics to discuss over the next year. Happy New Year in 2023.
Thanks, Mike.